Jane, thank you as ever. Jane McCormick, our political reporter. We're joined by Colin Neal from Hospitality Ulster, Dr. Alan Stout, the BMA GP committee chair here, and Felicity Huston, business leader and Conservative Party member. And we are taking your calls. 030 80 55 55. That's the broad outline. We're pretty sure over what we're saying, incidentally, across these 9 pathways and the 5 steps. It contrasts, doesn't it, with what you've seen from Boris Johnson's government in England, and that applies to England, where they have 4 stages separated by 5 weeks, stage 1 to stage 2, 5 weeks apart. Indicative dates are included. Indicative means that's the earliest date at which you could move to the next stage. You have to have surveillance, you have to monitor everything and be sure you're ready to move to the next stage. But that's the contrast between what they're doing in England and what we appear to be doing here. What do you make of it, first of all, Felicity Huston?
Well, I'm one of life's natural optimists, and I have for the past nearly year now convinced myself that someday this would all stop and we would have our lives back. That is nearly gone now with me, and I think many people are the same. I just think that Dr. McBride, our Chief Medical Officer, sets the policy, and that's it. And I mean, told us 3 weeks ago that there would be some restrictions possibly lifted in the summer, and then the restrictions be tightened up, and he didn't see them go in for another year or so. And I mean, I think that's just where we go. And whatever the ministers say...
Well, of course, he would say he advises the ministers.
Yeah, no, but I mean, we find
and you've got all these ministers have to agree around the executive table. I doubt he has that kind of power, does he?
Well, he seems to have. I mean, once Dr. McBride announces something, the media takes his views, and that's very much what we go with, and that becomes the next outlook. So hopefully Dr. McBride is happy with this, and then we can go ahead with whatever's being put forward. But it's very hard to know. I mean, I gather the Chancellor is keeping furlough in place. That will continue to ease it all for people. You know, there was 6 million in the UK on furlough. That helps people stay in the current position. But I'm past the stage where I ever think that really I can see when life might be normal again. The latest is now, I gather scientists looking at it as wearing 3 masks to go out in rather than just whatever the current restrictions are. Nothing ever changes. I'm afraid, the cheerful woman that used to be around is long gone.
Alan, just on that final point before I come to the roadmap, I can't let that go past, really. Multiple masks.
Yeah, so it's interesting. The WHO came out today as well and said that one of the key things for the rest of this year is going to be reducing transmission of the virus. And that's absolutely right. I mean, this isn't just about us here. It's not just about the UK. It's not just about the island of Ireland. We get out of this when everybody else gets out of it. And that's why transmission is so key. So, I mean, the 4, I think I've mentioned it before on your programme, but the 4 key bits that we're trying to balance at the moment is vaccinating.
Yes, I was going to come to that. So I don't want to just throw that away in the metric, but do you agree with the idea of wearing 2 or 3 masks as a better way of stopping transmission?
I think the point that is showing is that transmission is going to be so vital. So things like wearing a mask, whether it be 2 masks or 3 masks, but also the social distancing, the good hand hygiene and so on, that's the key thing. And that's one of the big messages as we move out of this, is that the infection, COVID, is going to be with us for quite some time.
And Alan, is this to do with these new variants? A worry about these new variants that just additional masks might give you a bit of additional help? Because some people have masks, I know. I mean, I've got a washable mask, but some people have these masks where you put little bits of, paper, whatever it is, barriers inside the mask. That has the same effect. You just double that up, wouldn't you?
Yeah, very much so. And you're absolutely right. It is predominantly about the new variants, and it is about just controlling the spread, getting the infection numbers as low as we possibly can. And that gives us the position that we can confidently and sustainably start to move out of a lot of the restrictions that we have at the moment.
I imagine Colin Neal saying I wouldn't care if they asked me to wear 5 masks as long as I can get my business back open again, Colin.
Absolutely. Look, and I mean, obviously we're all still speculating, but it's pretty confident there'll be no dates in this roadmap, which is really disappointing because it's about giving hope to people. You know, it's giving hope to businesses so they can plan, because they're sitting today going to try and borrow more money. How long's that for? and look, we've all learned that indicative dates can move, but government has to learn too from things we've done in the past and work with us to try and actually save as much as we can.
You see, Colin, what they say in England is they have learned this about indicative dates. So many in the public went off and booked holidays. And then when they had to change some of the dates in the past, there was an enormous political row about that. People saying, well, I was following your dates and all that sort of thing.
But I think, both in Scotland and in England, they have stressed their indicative dates. I think we've all learned from past experience what indicative means, that, look, it can be pulled all together or moved.
Yeah.
Exactly. But if you look, we have the Office of National Statistics, the government's own statistical people, saying that 2/3 of businesses now don't have enough cash to survive to the end of May. If we're looking here at a long, slow process, the Assembly need to come out, or the Executive need to come out today, announce what sort of funding, what additional funding is going to be put in place to save these businesses, because otherwise we'll lose them at the 11th hour.
Alan, I've stopped you twice trying to do this, and I want to hear from you on it, so let's do it now. And that is the 4 points you've given us before, which you think are the advisory metrics, really. These are the things we need to get under control and pay close attention to in order to get from step 1 to step 5 across all of these pathways.
Yeah, so first and foremost is vaccinate as many as possible, and we can see how well we're doing with that. And that is quite clearly reducing hospitalisation. That's reducing the severity of illness, and it's reducing deaths, which is great. But at the same time, this isn't just solely about vaccination. We have to get the infection rates down as low as we possibly can. And that then allows the third point, which is having a really robust track and trace. And you can actually see from other countries, and particularly New Zealand, and the examples coming out of New Zealand, where they lock down very quickly or shut down locally very quickly when they get a small, even a very, very small spike, and try and control it that way. And then the fourth, quite critically, which you've mentioned already, is trying to control and limit the variants, because at the moment we're being lucky with the variants. But it is a variant that is resistant to the vaccine is the greatest fear in all of this. I don't want to be negative. I don't want to be spreading doom, but that's what wrecks everything, is if we get a variant that the vaccine isn't protecting us against.
Incidentally, we had the Chief Minister of the Isle of Man on a while ago, you'll remember, and they locked down the entire island, and they went in fast and they went quick, a bit like the New Zealand model. And they've had for a long time now people going to bars, businesses opening, not wearing masks, people doing normal things because they were really, really rigorous about it. And yet today, the island announcing that it will go into a 21-day circuit break lockdown from tomorrow, with social distancing, 2 meters returning, face masks, public being asked to stay at home, all of that. So it just shows you how, if the infection gets in again, even to a very controlled community, it can run riot. Stephen's in Derry. He's a driving instructor. How are you doing, Stephen? What do you make of this plan for the roadmap? Oh, goodness, sorry about the pun, being a driving instructor, Stephen. The roadmap to recovery as we're finding out more about it.
Well, I think, William, for a start, we want to be treated as adults, first of all. We want to be trusted in the message. So if the message is conducive with, what's coming out of Stormont today, then we can all buy into it. We can all understand what is required going forward, so that we can look forward with hope. At the minute, we're being told, well, there is no, dates available for this plan because we don't know what the future holds. Well, we know that, but if we were given some dates, we would then be able to look forward and say, well, if we do things right, if we do adhere to all the rules and regulations, as Alan's laid out there, the roadmap can be done, but we have to do A, B, and C. As a driving instructor, I'll give you an example. We are told we could be back at work, but what's the point of us going back to work at the same day as driving tests become available? Someone who hasn't had a driving lesson in 10 to 14 weeks can realistically go and do their driving test as soon as the test centre opens, even though driving lessons haven't been put back in place for the practice to take place, so then people are ready for their test. It doesn't make any sense to me, William, as a driving instructor. The day that I go back to work is the same day as the test centre's open. That makes no sense at all.
So, I'm detecting, obviously, and I was expecting it, Stephen, that you want more information, you want more indicative dates, you want to be treated like an adult, you say, and I'm detecting your frustration with what you're hearing from the executive or what we expect to hear from the executive. I guess they might say to you, though, if they were to give you a date and you start planning towards that date, and then days before that date, they have to say, look, something else has happened. It was unpredictable, but we can't do what we were planning to do on that date. You'd be shouting back and saying, look, you've cost me a fortune getting ready for this date, and now it's not going to happen.
Well, William, you're not understanding the point. The point is that I wouldn't be shouting, you've lost me a fortune in terms of the government. I would be saying that the people have let me down, the people who've been given a chance to do as they're told, to adhere to the rules and regulations around, all the social distancing. It's the people who would be letting the likes of me down. It would be me and my friends who would be letting us down because we would not be adhering to the rules. But what I'm saying is, if there's new variants coming in, William, why are they coming in? They're coming in because we're allowing travel. If people if the numbers are going up, it's because people aren't adhering to what they've been told. So we can lay the blame wherever we want, but at the end of the day, it's our responsibility as human beings and as citizens to do the right thing. But it's also government's responsibility to lay out, if we do those things, this is the reward we're going to have going forward.
Yeah. Stephen, great call. Thank you very much. And just on that point you make about travel, I hear people in England saying, we're worried now about this Brazil variant. Why were you still allowing flights from Brazil to come into Heathrow, for example, and bring infections with them? Nigel is in County Down. Hi, Nigel.
Hi there, William. I think Dr. Stout maybe touched on my point, which is that there isn't only a sectoral dimension to coronavirus infections, i.e., sport, home, leisure, work. There's also a geographical dimension, even within Northern Ireland, with certain geographical areas having, outbreaks and a rise in infection rates. And the question is, what are we going to do, and are we prepared to do it to control that, which might see these localised lockdowns or mass frequent testing of particular geographical communities? Are we up for that? Is it part of the plan? How's that going to operate? How would the population react to that? Because shutting down sport in Belfast because there's an increase in infections in Fermanagh wouldn't make any sense, would it? So I'm just wondering what are the thoughts on that?
Thank you very much, Alan, on this variant thing. We're still trying to work out the relationship between this variant, aren't we, and the vaccine with Alton Power on. He seemed less worried about the Brazil variant in terms of our current vaccine than maybe other kinds of mutations out there.
Yeah, no, Alton's right. I mean, that's why we have been fortunate to date that the variants are showing that the vaccine will actually still be protectant against them. But Nigel's making a good point. I mean, I think what he's describing is the ideal scenario where we have really, really low infection rates. We have the vast majority of the population protected, and ideally across the entire island of Ireland. And that then means that whenever we see pockets, and it doesn't matter whether it's a variant or not, but when we see pockets, we can identify them really, really quickly, and we can get on top of it and control it really, really quickly. And I think that is the absolute ideal situation that we can hope to get to over the next few months.
On Twitter, Belfast City Fan has a question for Colin Neal. Colin, he says, how come Colin Neal has rolled back since last year, championing lockdown, wearing 5 masks now? Has he fallen in line? Question for you.
Well, one, we didn't champion lockdown, but we did when this lockdown was announced. We said we would support it because it was the right thing to do. We didn't welcome it, didn't want it, and we recognised it was with a heavy heart that it would cost jobs and businesses. And it is. Look, but it was the right thing to do. I think everybody would agree. But we now need to actually, one of my criticisms of the executive is they are not engaging and planning with us. I respect that I have great respect for the Health Minister and the CMO, and they give medical advice to the executive. But the executive also need to engage with us and understand what we can do to meet those challenges. Like we have an electronic track and trace system now, held central server that can be available at all our pubs and restaurants, hotels, coffee shops. but nobody's talked to the executive us to know we have that and how it works and how that would help. And all we're really saying is, look, yes, we wanted dates, but we're not getting them. We're big boys, we'll take that. We don't want to run the government. We don't want to make the decisions, but engage with us. Start.
Has there been no engagement at all with? Has there been no engagement at all with the hospitality sector?
No, since this lockdown began, no.
Wasn't there supposed to be some kind of task force group and people talking?
I mean, there is a high street task force, and tourism have a tourism steering group and stuff. But hospitality goes way beyond tourism. Hospitality has a huge footprint, and it actually, I would argue, it binds society together. It's where people go to meet. It is a huge economic and social footprint, and it deserves.
Well, you wouldn't have any tourism without hospitality, would you?
Well, that's it. The same as 1/3 of agri-food, and Northern Ireland's agri-food is bought by us. The future of our high streets is going to depend on leisure and hospitality. One of our key asks, and our only ask has been throughout this lockdown, is please sit down with us and plan.
Felicity, I'm getting a lot of comments here about your opening words, which many people have said are incredibly pessimistic. Given that we're doing so well with this vaccine rollout, given that we have metrics that can help us understand where the science is growing every minute of every day, why are you so pessimistic?
Well, I suppose because every time we are offered something that's going to help us, like the vaccine, I mean, maybe I misunderstood, but when the vaccine was first announced, and it's a tremendous achievement for science to produce this thing so quickly, we were very much told that once those who were most vulnerable and had suffered most badly in the past year were vaccinated, that, things could gradually begin to get back to normal. And certainly that's the impression I got, and maybe I got it wrong, but that didn't happen. And I mean, actually, I'm now looking at being offered a vaccine, and I don't think I'm in a vulnerable group at all. And yet that didn't happen. It's things like that constantly.
But I never understood I never personally understood the vaccine as a silver bullet. No,
not a silver bullet, but it was going to make the difference. If what we're worried about is the health service being overwhelmed and a disproportionate number of deaths, comparison with averages, they came from the elderly. We know that from the statistics. Yes, things change, but in general, that's the case. And those people, I'm delighted to say, are all vaccinated, and they're much happier, and they shows the statistics and the figures show that apparently they're not going to be so vulnerable, they're not going into hospital, etc., etc. But it doesn't seem to have made any difference. Do we remember 3 weeks to flatten the curve and protect the NHS? And now, the people who ended up in hospital with COVID were, in general, the people who are extremely old who have now been vaccinated. And it hasn't made any difference. And it's just one thing after another. I mean, I'm curious about you talked about the Isle of Man. I mean, my understanding is it's almost impossible to get into the Isle of Man. You might remember the man with the jet ski. And
yes, he got arrested.
And yet, COVID is back. It hasn't gone away, to use a Northern Ireland expression.
And you can be sure that it's because it got in by somebody doing something daft, like trying to get in with a jet ski.
Yes, but that was months ago. I mean, how they don't know, and my understanding is how they've got it again, but it's back. And that's one of the issues.
It's got in from the outside is how they got it again. That's it.
If they believe that you can have zero COVID, then how are we going to live? And that's my concern. And the Isle of Man is a very good example near us of what's going on, and they can't get rid of it. And, is this how we have to live, that there's every now and again we have another massive close down? I mean, it appears to be the case that is the sort of increasing
eventually
outlook.
It'll change when you've got global levels of immunity, of course.
But how are you going to do that
it's going to take a while to get there.
Sub-Saharan Africa, in the slums of Kenya?
Yeah.
How are you going to immunise those people?
We have the World Health Organization COVAX programme,
but how long is that
trying to get the vaccine to developing world countries who can't afford it. It's going to take
years.
I would have thought years.
Yes, it'd take years. I mean, look how long it's taken to get rid of polio.
Yeah,
right?
Yeah.
So that means that for the indefinite future, this is how we're living.
I mean, get vaccinated and keep doing your social distancing and keep doing your hand washing as well. Let's go to Wayne in Warren Point. Hi, Wayne.
Good afternoon, William. Good afternoon, Paul. William, I think this, in all honesty, is a disaster. Because see if this goes wrong and we're...
It hasn't even happened yet. How's it a disaster?
Well, if we put it like this, if it does go ahead and then have to close down again, why do they not just vaccinate, close down to June, vaccinate everybody, and then after that, let them all go out gradually from there on, get as many vaccinated.
So you would keep the whole of Northern Ireland in a full lockdown until we've got the entire population vaccinated?
Well, according to them, they should be well up to date by June. The South's still running behind before.
Well, it take us longer than June to get the whole vaccine.
Well, there's a new vaccine centre, according to them, it's going to do about 40,000
but it's going to take longer than that.
But the only problem is, it's all right saying it's affecting people's mental health. Like, I'm sitting here as a carer for two.
Wayne, I understand that, but you're the one suggesting keeping everybody in lockdown until the entire population is vaccinated. You would actually extend the lockdown problems, wouldn't you, by doing that?
Yes, but what happens if more virus comes out, puts more pressure on the health service, then with a backlog up there? It's going to be actually 10 times worse than it is now. We're going to have to close back down again for another 6 or 12 weeks.
Wayne, thank you for that. I'll just put that point to Alan. Just respond to Wayne, if you would, Alan, in terms of the science around this.
Yeah, no, that's just totally impractical and impossible to do. It's really important, and actually just to pick up on Felicity's point as well, it's really important to understand what we try to do with a vaccination programme. So the initial stage of the vaccine was very unambiguous. It was about protecting as many people as possible, and we've been really, really successful with that. But that was the sole aim, so stop people getting really, really sick, stop them getting hospitalised and stop them dying. The second phase to a vaccination programme, as the numbers increase and you go beyond the at-risk groups, is you really do start to reduce the transmission of the virus. And that becomes the really important part in terms of what we're discussing today, in terms of opening up society and so on. But the third part then, and the reality is we're never going to get to this part with COVID, just like we've never got to it with flu either, is that you eradicate the illness altogether. And Felicity used the example of polio. That's an example of where a vaccine has actually eradicated an illness.
Yeah.
But it's very, very rare for that to happen. Most of the time you end up...
In the case of these vaccines, again, it's a misunderstanding, isn't it, Alan? People thinking, if you get this vaccine, you'll never be able to get COVID.
Yeah. No, that's not going to be the position that we get to. This will become endemic as opposed to a pandemic, where we're living in a controlled environment.
We'll continue to have people dying from this every year in countries around the world, just like with the flu.
Yeah, and we'll continue to need to vaccinate as well, more likely than not.
Andrew is in Lisburn. Hello, Andrew.
How you doing, William? How are you?
I'm doing very well. Good to have you on the show.
William, I think it's this roadmap is going to be a nightmare because it's not going to please everybody. So you open up everything again. Why not try and do it stage by stage? Open up schools.
He sounds like he's in a war zone, doesn't he?
Let the kids go back. And if the kids, whenever the kids go back to school, the R rate's going to go up big time. Everybody knows that. I haven't seen my mother and father in over a year because of this pandemic. See them through a window. I think the Arlene Foster and Michelle O'Neill need to realise and listen to Michael McBride and the doctor. I don't know what's going to happen. It's going to be scary.
Andrew, thanks very much. Of course, the plan is 8th of March, so that's 6 days from now. Schools have a staggered opening with blended learning as well. So not all of the schools at once, but cautiously, over a number of weeks. Let's go to Brian in Bangor. Hi, Brian.
William, good afternoon. William, I think that people with this country need to be very patient at this time. I mean, this has gone on now for a year, and I hear people talking about, some people say, oh, there's no virus, and there is a virus. It's all about our attitude to this, Are we the only people in Northern Ireland who are suffering? There's people all over the world who are suffering. I think we need to be patient. The people of this island need to come together and need to pray for those in authority. And it's all about working together, not to give up in well-doing, and to keep our attitudes right.
Thank you very much, Brian. And of course, we have to say, not everybody's equal in this. We're not going through this in the same way. Not everyone has a garden. Not everyone can work from home. Not everyone has a furlough scheme. Not everyone has a business grant. Not everyone has the resources of everyone else. Colin, that's why this is so difficult. It's so unfair. And it's not an imposed unfairness, we might say. It's a natural unfairness that comes from pandemics. That's what they do, Colin.
Absolutely. I mean, it is unfair, but it's trying to actually, I suppose, look, we have to manage the risk from COVID, but we are going to have to get to a point where it's a managed risk. I think we all realise that it's not going to go away. But if we want to protect the jobs, we have to put the right money in place to do that and the right measures in place. And it really is that, we have to work together. Government have to stop just doing stuff to industries and different sectors. Sit down with them, work out, tell us what the benchmark is, what needs to be done, and we might have some solutions. And I think it is treat us all like adults and share the evidence so we all can understand it.
We'll get more of the budget today, obviously, Felicity, but one option would be, debt is... borrowing, I should say, is cheap these days on the international markets. Shouldn't the government, shouldn't the Chancellor be even more ambitious in terms of borrowing and get a lot more money into those bits of the economy that are really, really struggling for no fault of their own?
Well, I mean, he is. I think from the rumours we've heard, he's going to be hurling money around like nobody's business tomorrow, and has done for ages. And they can do it because it's cheap. But, it's one thing to give people money to stay at home, or both my adult sons have been very badly affected by this. I've been very lucky. I work from home anyway. I've been fortunate, but I know they and their colleagues, their friends and their generation have had a terrible time. But they don't just want money to stay at home. They want to go back to work, because work brings so much positivity with it, all sorts of things. I mean, the doctor will know about the health benefits of actually working, just... The Chancellor just handing out more money like Soma in Brave New World is not the answer. People actually want to go back to being normal and living their lives and working. And I mean, my son, who's a restaurant manager, he loves the buzz of the hospitality industry, Con, as you would be so aware of. They love it. It's a thrilling thing to work in. And paying him to stay at home is not what he wants. And he's just one example, because that's my family. But there are millions of people like this who just please like to go back to work.
For sure. Yeah.
And the government throwing subsidies at people is not the answer. It may make
if you don't have the money, you could do with a bit of money,
If it may help them feed their families, and it may help keep their mortgage and everything, but it is not what most people would like to go to work, please, Make
a big difference if your mortgage and your food bills are taken care of course. Felicity, are you looking forward to the vaccine? Getting the vaccine. I can't wait to get it. Well,
that's a whole different matter entirely. I may have my son, the other son, some of you will know, is an Olympian and is all being well going to Tokyo. He should have been there last year. I can't imagine the Japanese will let anybody in who hasn't been vaccinated. And I would like to see my son compete again in the Olympics. So I will make a decision based on that. Because I'm not
You're not
in a
sure
risk
if you're
group.
going to have it yet?
Well, no, I probably will because of that, but I'm not in a risk group. There are many more people who maybe need it instead of me. Mm-hmm. But I mean, a few years ago I went to Zambia and I had to get yellow fever to get in, yellow fever jabs. Mm-hmm. So it's sort of a bit like that. It's not, and I mean, it's interesting just how many people...
But the real success of this, Felicity, is, even though you're not yourself in a risk group, getting as many people vaccinated globally is the way out of this, not just the people who are most at risk.
Yeah, but I mean, if you give it to me or do you give it to somebody, as I was saying earlier on, in the third world who actually may be in a much more vulnerable situation, there's much more vaccinating of children in the third world because they're so much more vulnerable to the diseases which our kids can pretty well shake off, and it kills them. Measles being an example, I know they're still giving out
and that's the point of the priority list,
but measles
of course, isn't it?
will kill children in the developing world. A child death from measles in the developed world is relatively unusual. This is the difference. Who are the risk categories and so on. But I mean, your plan, Will, that the world has to be vaccinated before we can live normally is going to take us a long time.
Alan, just your final thoughts on Felicity's kind of moral dilemma there in her own mind.
Yeah, it is. It's a moral and an ethical dilemma. This is something that has been raised quite widely in terms of, and it is that kind of world view on it, is that we need to make sure that people in the at-risk groups, the people that are most vulnerable to the infection, are vaccinated worldwide. And I know they're all, and you mentioned the group, the worldwide group, looking at the sharing of vaccines as well. So that is going to be important. We've got to look at this outside just our own backyard. It's got to be a true international programme.
Thank you all so much. Colin Neil, Alan Stout, Felicity Huston.